Next, we have Mr. Kawazo. He's from all the way from the east, from Japan, and he's been working in the area of home healthcare, where they provide healthcare services. Japan is an aging population, so they have a fairly large segment of people who need help and medical help at home. His foray into primary care into India is very interesting, and we'd like to understand what exactly is the kind of business model that they're trying to bring to India as a result of their success story in Japan.
Thank you for the introduction, Mr. Vijaya. And I also would like to thank Ficci for giving me the opportunity to speak to you, everyone. So, firstly, I'd like to tell you about brief history about myself and our company. I'm the founder and CEO of CarePro, and I'm also a nurse. I founded this company in 2007. We have a lot of partners, a lot of supporters, such as Social Venture Partners, Ashoka Foundation. Today, I'd like to tell you 2 points. Before I start my presentation, I'd like to show you a brief video clip of a TV program.
Shinjuku, central Tokyo. Around 170,000 people pass through this busy station each day. This particular morning, a stall is being briskly erected in the corner of one platform. What could they be doing here? They are offering health checks. The company behind this service aims to help people monitor their own health. At the bargain price of just 500 yen per test. His interest piqued, this 51-year-old passerby decides to undergo a pulmonary capacity test. This device measures patients' respiratory capacity to estimate the functional age of their lungs. How did this man fare?
肺活量やっぱりこの太ってるせいになった横隔膜も上がってるせいでやっぱり71歳でしたね。やっぱり肺の機能が落ちると肺炎とかそのいろんな感染症にかかりやすくなるのは事実ですから、これは大変いいと思います。
One of the company's more typical health check stations is found in this shopping mall. And business appears to be booming. Today's customers include this 60-year-old woman. She's having a bone density check.
測られたことあります？ない。初めて。はい。面白い。
The test takes only 5 minutes. And at just 1,000 yen, it's very affordable.
結果どうでした？
まあまあ、年相応ですって。なんかちらっとこういうふうにやるっていうのは500円か1000円ですよ。1000円ぐらいだったらお昼食べなければいいもんじゃないよ。どうも。
Another of the company's premises can be found in a shopping complex off this retail arcade extending from a station in western Tokyo. At just 33 years old, Takashi Kawazoe is the man behind this innovative health check service. This location also offers blood tests, with a difference. Here, patients extract their own blood samples.
はい、ではそこでちょっと強めにグッとしていただきます。はい。針は折っていただいて大丈夫です。
As patients draw their own blood, this test is not classified as a medical procedure and doesn't require any specialist facilities.
This is a disposable needle. You push this button and the needle deploys after you remove this cap. Customers hold it like this and prick their finger. The needle can only be used once, but even just a drop of blood from the fingertip is enough for a test. These are some of the analytical devices we use. This one tests your blood sugar in just 10 seconds. This one can measure cholesterol and triglycerides in just a few minutes.
Other devices are used to measure liver function and hemoglobin A1C. Unlike regular company workers, the self-employed, homemakers, and the elderly don't receive routine annual checkups. 1 in 4 Japanese has gone a year or more without any such examination. And these were the people Kawazoe had in mind when he came up with the concept of accessible self-health checks. The staff who supervise the blood tests and give advice based on the results are not doctors, but nurses. This keeps personnel costs down, enabling the company to provide this service at the knockdown price of just 500 yen per test.
ここだとすぐ簡単に短時間でしかも安くてできるので気軽に健康診断利用しました。
So far, around 300,000 people have taken advantage of Kawazoe's self-health checks.
So now, I would like to tell you the reason why I started this business. As you can see in this picture, this is a foot of a diabetic patient. I met him when I was a nurse. This could have been prevented if he had received health checkup. Even though the government provides universal health insurance in Japan, there are about 40% of Japanese people who do not receive annual health checkups. Also, the total amount of medical expenses in Japan is about $400 billion per year. Under these social issues, we decided to have 2 missions for our company. Sure. Okay. First is to prevent lifestyle-related disease. Second is to reduce medical expenses. There are 2 main reasons 40% of the people do not receive the annual health checkups. First reason is because the health checkups are too expensive, and another reason is that it takes too much time. To help these people, I came up with a new model, which we call on-the-spot health checkup system. Our service only gives them the infrastructure to test themselves, so it is not considered as a medical practice. That is why we can provide this service with only a nurse who assists the users. With this operation, we are able to provide quick, affordable, and accessible service. These are the test items we provide in Japan. We provide blood sample test as well as non-blood test. This is service floor. This is our permanent shop in a popular train stations. And another permanent shop in a shopping center. We also provide temporary service on visit basis. This is an example of when we did a one-week event at popular train station. We also set up mobile shops in other locations. This is an example of our message from our user. Our service was also recognized by the Japanese government. In a national committee held in 2013, the Prime Minister made a remark referring to CarePro, saying that we should promote self-health checkups center because it can reduce medical expenses in Japan. After this national committee, CarePro took initiative to develop a new policy guideline of a new classification called self-checkup center because this was a new type of healthcare service that did not fall under the existing regulation. Now we have more than 300,000 users in total. Our main users are housewives, no workers, seniors, self-employees, etc. We have 4 shops around Tokyo with more than 100 events per month. Our statistics show that 49% of users have not taken health checkup for a long time. 30% of users at an abnormal level, and 24% of users plan to go to the hospital after testing. Now we are planning to start a business in India. We have already done a trial event in Bangalore with collaboration of a hospital. We have received positive results at the hospital. Out of 100 users, 3 users made appointments with the hospital right after getting the checkup, and 16 users said that they plan to come back to the hospital for further inspection. We also plan to provide a service at shopping center, ID parks, and residential complex as well. Here are our partners and sponsors and are open for more collaboration partners in India. This is our paradigm shift in Japan. As I have explained about CarePro's service, we try to create a care pro cycle in which the user gets the health checkup, notice about their health condition, take action to improve their health, and think about their health. By doing this, our big vision aim to prevent lifestyle-related disease and reduce medical expenses. Now we hope that we can be a lot of India's paradigm shift with you. Thank you very much for your attention.
Kawazo-san, thank you very much. Appreciate the fact that you have your eyes in Bengaluru. I think that's a place where a lot of interesting and innovative ways of. I know this is probably my second encounter with a person who's actually trying to do retail diagnostics on a what you call as a self-care mode. Thank you very much. Yeah. We have Yogesh here, who's also another veteran in the Ficci rounds. He came and first presented his new breakthrough innovation where he could measure anemia without pricking the finger as a non-invasive diagnostic method. And Yogesh, would you like to share with us your journey and what do you think it takes? It's more like a boot camp, guys. What it takes for young entrepreneurs like us to watch out for when we are in the journey.
And Yogesh, before you,
yes.
Mr. Mishra has to leave sharp at 6 o'clock, so we would like to have the benefit of him speaking to us at least for 5 minutes. So just a little cognizant of time. Sorry to push you like that.
Hello. Yeah. Hi, I'm Dr. Yogesh, co-founder and director at Biosense Technologies. I started my journey when I encountered a problem of anemic female delivering a baby in PHC when I was a doctor placed there in a rural village. Somehow we managed and referred that case to the rural hospital. But that initiated the process of why this problem of anemia is there. In India, while the treatment is very simple, like iron folic acid tablets and dietary habits. And we started our quest to democratize healthcare. This word, Mrs. Piramal taught me what democratize healthcare mean when I won the Piramal Prize competition in IIM Ahmedabad. And I like that, and I like to keep it in a session. So we started accidentally with this. This was the poster one of the slide which I presented at WHO when they selected us as one of the technologies which should be adopted for public healthcare, especially the non-invasive hemoglobin O measurement. And right after this, I hired a designer, and I made him a co-founder because this was a messy poster to make. But if you look at this, I started with completely public healthcare focus because I was not corrupted with any management background. I was not corrupted with any financial background, and the intention was so pure. So I thought, let's go to the PHC and install this device. 3 years later, when I couldn't do that, one of the mentor in pharmaceutical company said, why don't you give me some of your devices? I'll do camps. So I said, how many camps you will do, sir? This will not sustain me. Government is the body who can sustain entrepreneurs like us who are developing innovations for public healthcare, right? So just give me 100. So I said, okay. And I started giving, and that's how the business clicked. I never looked back. There are several pharmaceutical companies, even physicians, about 3,200 of them are using our devices, different devices. I'll be telling more about that. But this is a dream, very bad one, but yeah. So these are the three key products. TouchBee is our hemoglobinometer. UCheck, which is a mobile phone-based urine analyzer. We managed to piss off US FDA with this urine analyzer. Uh, when we uploaded it on App Store for free, and that you can do your urine analyzer, urine test by yourself, because that's what democratizing healthcare means, right? Then they said, okay, don't do it like this. Can you manage to do it like this? So we said, okay. So we released an updated version which had certain parameters which cannot be done, and we realized. But we have also developed a glucometer with ICMR, which was launched by our honorable health minister, a 3 rupees strip glucometer. We have also developed a meterless glucometer strip, so it can be used without a meter. So a lot of innovations. I have 12 innovations, right from thyroid panel being done on mobile phone to urine analysis, microalbuminuria, non-invasive hemoglobin. We are also developing some interesting innovations in services where a lot of this test can be done at the clinic with a small device. So this is the UCheck device which I was talking about. It can detect urine tract infections, maternal and child health problems like preeclampsia, nephritic and nephrotic syndromes. I got nephritic when I was 12-year-old. Liver diseases, complications of diabetes, and other kidney diseases. And albumin to creatine ratio as well, where it is the earliest marker accepted by ADA, where for nephropathy, especially in diabetic and hypertension. The second innovation is again a mobile phone based image processing innovation. We have two versions of this, one of which I presented last time, the pulse oximetry based hemoglobinometer. We are working with an international company for commercialization of that product. This one is the mobile phone based, so conventionally doctor has been testing your anemia like just by pulling your eye and seeing something, and oh, you need to take iron, right? So we quantified that. We removed the subjectivity. Of course, it is not as accurate as the lab or even, but it is closer to point of care technologies. It is definitely better than WHO color scale, which is being widely used. I don't know why. Um, and it is definitely better than a very ill-maintained Sahali's hemoglobinometer, because they are not maintained properly. I have been to 200 sub-centers, more than 60 PHCs myself. I've seen them in worst condition. This device is more suitable for screening and monitoring at community health, school health, adolescent health, especially because they are going to be mothers, and if she is anemic, she is going to deliver a low birth weight baby, and then 50% chances that baby is female. Again, she will have underdevelopment. She will be mother again, and this whole vicious cycle continues. So very easy and simple technologies. Since we are using mobile phone, we are having data functionality as well. So we have already started working with Rajasthan government with 400 centers, where all of our devices, including glucometer, 1200 ASHA workers are using our glucometer, and all the data is flowing to our cloud, and we are giving analytics to Rajasthan government. The key, the start, I'll stop here since sir has to speak, but I have a lot to share. Yeah, look forward to it. Thank you.
So, ladies and gentlemen, this was just a sneak peek into what's happening around innovation in India, for the rest of the world. And this is just the beginning, as we say. So I think what we picked over here were just 2 or 3 examples of what's happening in our own backyards, in our own garages. And innovation is actually happening in India. So I think from here, the journey of startups, and we at Ficci are now trying to ensure that the startup ecosystem in India gets a lot more visibility, particularly on the healthcare side. And this is the first time that we've sort of brought everybody together, and you'll see more and more of this happening out of Ficci, celebrating innovation out of India. Let me quickly introduce Mr. C.K. Mishra from the Ministry of Health and Family Welfare. Mr. Mishra has joined the Indian Administrative Service in the year 1983 and was allocated to the state of Bihar. He had most recently served as the Joint Secretary, MSME, and Principal Secretary, Government of Bihar, holding portfolios of different departments as industry, health, and power. I must mention that Mr. Mishra has been a very, very good friend of Ficci, and I know we always call upon him for judging our competitions, for basically being a thought leader with us and pushing us to do something different. And he's constantly pushed us harder at Ficci to keep on thinking anew. So welcome again, Mr. Mishra, and we look forward to hearing from you.
Thank you. Thank you very much. It's been an exceptional learning experience. And the kind of innovations and the kind of new ideas that are being thrown in the field, not just in the form of enterprise, but just sheer ideas that can change the landscape of healthcare. I mean, let me be honest, they can even ignite and excite a Sarkari mind. A lot is happening, but please do remember that when we talk about the Indian scenario, you really are looking at just about 2.6 crore children being born every day and being added to that basket which has to be provided healthcare. We are not looking at numbers in terms of, even crores. I mean, it's the task is gigantic. But then, even if several innovations can take care of parts of it, the total sum will be huge. And that is what really needs to be done for the Indian healthcare. Let me make it very clear. In India, primary healthcare, even today, remains a sole concern of government. There are very few interventions being made in primary healthcare. Therefore, when I heard some of the interventions in the primary healthcare, I was very happy because this is what we need, and we need millions of such interventions. Let me just start with what Mr. Savarkar had to say. I quite liked his closing remarks that we should wait for a parallel network to government. I really wish that this parallel network to government comes up. But honestly, what I wish much more than that is that if the two parallel lines could meet at some point of time, that is what will add value to the system. You can't run a healthcare system in the country with sporadic parallel efforts. Those lines must meet. We keep talking about, providing accessible, affordable, quality healthcare to everyone. That's the goal and motto of all the innovations that we saw just now. That is the avowed vision of what the National Health Mission, or for that matter, any government of India, and that we have. Most of the deliberation that we have in such forums is about hospital care. If India has to grow as a healthy nation, we need to move this discourse to healthcare. So this movement from hospital care to healthcare must take place true and proper. And that is where most of the ideas and innovations really count. Because what are we innovating for, ideating for? When we talk about access, a lot of access has already been provided. Government is also spending a lot of money to make it affordable. But where is the quality healthcare that you are talking about? So these ideas actually need to take place at the level of delivery of healthcare. And that is where these innovations need to really come about. When we talk about technologies and innovations, which will really spur this, because we can't increase the number of people in the ground. I mean, it's not going to happen very easily and very soon. We need to have innovations, I personally feel, which are grounded in reality. And if they are not grounded in reality, they should have the capacity to change the reality. You can't have a third scenario. Otherwise, we will keep talking about innovations, we will keep talking about pilots which will never be given scale. And in a healthcare system like India, unless these innovations are put to scale, it will not make a major dent. I'm not saying on its own they are not incredible. But what is desirable is that they're taken to scale. And in doing so, we really need to keep in mind the kind of systems we work in. We heard a lot about innovating for India rather than, technologies and equipments that you talked about for the entire world. That is where the challenge lies. What is it that we really need? We don't need a doctor at every center. For the kind of treatment we are giving to patients, I don't think we need a qualified MBBS doctor everywhere. But what is that stand-in? What is that mid-level service provider, whether it's an equipment or it's a human being? That is what we have to decide. And that will be the ultimate game changer in providing preventive promotive health care in this country. Recently, we hosted a seminar on innovations in Shimla. Various state governments came up with exceptional innovations they were working on in the healthcare system. But after hearing all that I heard today, I'd like to make a distinction. What the innovators in government sector are doing today is an attempt to make the present system better, which is the incremental one that you spoke about. But what we need is the disruptive kind. But all these disruptive innovations that we are talking about, if they can at some point of time fit in with this incremental system that we have in place, the value will be much more than a standalone experiment. And that is where we need to talk to each other. It's amazing, I just heard about some equipment in Bihar where you're doing about 12 to 15 pathology tests. Amazing how little we know about what is happening in the country. For the last 6 months, a similar experiment has been going on in J&K on a standalone basis, whether we can do it or not. Rajasthan is doing a similar experiment for the last 1 year. That is what I mean when I say the two lines must meet. Not all of us need to experiment on the same thing everywhere. So, what really disturbs us is that we are not sharing all this with anyone. We share it on forums like this, and believe me, that's the end of it. I'm just trying to say what I feel. See, it's very easy to stand up and say that the government has failed in providing adequate health care to population X. And see, I have done it in 4 villages. One who has done it in 4 villages has done an incredible job. But why is it that he has not been able to move to the 5th one, which is the government's job? That is the question all the innovators need to keep at the back of their mind. What we need to really do is pick up these pieces and put them together. But more than that, issues regarding innovations and the venture capital that you're talking about, fortunately, have now made a strong presence in this country. What the primary healthcare scenario in the country needs is more in form of ideas. What is the biggest constraint to filling these gaps? If you ask me, there are 2 constraints. One is the resource, and the other is the human resource. The 2 kind of resources. In a country where we are producing about 56,000 medical doctors every year against a requirement of some 3 lakhs, it's impossible to catch up. So we really need to put our brains together to think that if we want to provide basic services, can we really have some mid-level provisioning where basic healthcare services get taken care of. Telemedicine, for example, we heard. It's a brilliant idea, provided, as he said, we are able to bring it to a fruition till the end. A brilliant innovation where a diagnosis is done, a consultation is completed. Why are we doing that? Because we don't want that person to go to a place X, which is about 100 kilometers or 50 kilometers away. But as you heard, if to procure his drugs, he has to go there, the whole purpose gets defeated. All our efforts at doing something good come to a naught. So we have to find some kind of a, in a management jargon, end-to-end solution. I don't know where it lies, but every such effort needs to be collated somewhere and needs to be put together in a basket if as a country we want to see radical changes in healthcare system. Otherwise, we will keep claiming from the government side, we've reached so much. Innovators will keep saying we have cured so much. The sum total will not add up to what we want it to. And that is the only point that I'm trying to make. With such innovative minds in this country, with such brilliance around, if we are even now not able to fire a team spirit to work together and take healthcare ahead, perhaps we'll never be able to do it. And I would be extremely happy, those who are working in the states, if they could get back to me so that I could talk to the states to try at least and see integration in those states. Government would be extremely happy to accept any proposal. We have said every state, if you want to spend money on innovating, getting private players to innovate, getting entrepreneurs to come into the field and take over part of your job, we would be very happy to even support the states financially. So this is something we need to do, and if Ficci can really become aggregator, I would say, that would be an excellent job. Thank you very much, ladies and gentlemen.
Excellent. You made my day, sir.
Thank you very much, Mr. Mishra. Let me also say before we end that it'll be good to have in these forums all the innovators come and also present to you the challenges that they face. I think what you've seen is the good side of things today. What you have not heard from them are the various humps that they need to cross to get somewhere. And I hope that, and I know Shobha has a solution for that, and to create these forums where they can come and express to you what are some of the big challenges that they face. May I now ask Shobha to sum things up, and we are at the end of the 2-day session. Dr. Sab, Dr. Puri.
And one who, as Vishal rightly pointed out, has been a friend of Ficci over the years. Okay. I have just been informed that the two teams from Hackathon who were supposed to make a presentation, so I can't end, can I, before the end? So
are they here? Are the teams from Hackathon here?
So
okay,
my job is the finals, the yeah. So
you're okay? About 4 minutes. You'll see some more innovation in play.
This is a problem that we are facing. I mean, even skilling, you have a sector skill council here. All of them are looking at some point or other. And I agree with you, and I'll request my colleague, the ASH, to get that done.
Thank you. Imagine a 3-year-old child suffering from severe pneumonia and taken to a PHC, and the PHC doesn't have a oxygen cylinder. The life is at stake because of lack of access to oxygen. Statistics say that the death caused by pneumonia in children under age 5 comes around 28 to 34%, out of which 25% is in our country. That means 1 death every minute, most of which is because of access to lack of oxygen. The common source of oxygen, what we get right now, is cylinders and concentrators. And when it comes to cylinders, we have to refill, transportation, and you can imagine in PHCs. So our concept Our concept is powered by simple chemistry. It's a kit-style product, lightweight, portable, easy to use. It can produce continuous supply of O2 wherever, whenever. These are some of the product features. It can supply 100 liters of oxygen at max 6 liters per minute, which is 99.7% medical grade pure oxygen. And the total weight of the kit is under 4 kgs. It is safe to store because the compound is inert. Even the temperature, there will be no degradation. And it's very easy to use. No training, the product will tell itself how to be used. It's simple 2-step process to produce the oxygen. Under 10 seconds, you can administer oxygen. And it is safe disposable because the compounds, the byproducts of this would be water and common baking soda. This is the product economics. We are looking at a canister, a refillable canister, cartridge, and a reusable container. And the refillable cartridge will supply us around 100 liters of O2. And the cost which we saw was 100 rupees, thus our value proposition is 100 rupees per emergency. These are some of the milestones we identified. We are looking at a 1 year from concept to product launch. And this is something in future we are looking at. The good thing is we have a segment which can readily adopt this technology. That is scuba diving and trekking. Those sports can readily adopt this one. This is the team, and right now my company G Healthcare and Ladis Innovations are mentoring me in the thought process. Thank you.
Good evening, everyone. I'm Shravya. I'm here to introduce Amy. Before introducing Amy, let me introduce Rahul. Rahul is a 4-year-old kid who is suffering from dyslexia. He lives in Bangalore with his parents. As he is dyslexic, he is not able to cope up in the normal school, and his parents both are working employees, and they are not able to spend adequate amount of time learning their child to read a storybook. And also, they or a middle class family, they are not able to afford to hire a full-time working ayah, nanny, who can help their child to learn English, to learn to read a storybook because of his disability, that is dyslexia. Like Rahul, 2 out of 10 children in India are suffering from some or other kind of dyslexia. Also, India has 1.43 million people who are visually impaired. Among 1.43 million people who are blind, only 5% of blind have received some kind of education. The present solutions that address these problems are: first one is reading aids. These are helpful for dyslexic people, and these are effective only for few kinds of dyslexia but not all the other kinds. The second one is scanners. These scanners capture the complete image of that particular normal page, and then the computer reads out the content in that particular page. So these are very expensive, and these are not portable. This costs rupees 60,000, which is very expensive for normal Indian blind person. The third solution is braille printers, which convert normal textbooks to braille scripts. These are also at the same time very expensive and not portable, and braille printers are not easily available for all the people. So to address all the problems we have stated, we have devised a product. We named it AMI. AMI stands for Advanced Acoustic Multimodal Interface. It is a simple fingering kind of device. This is working prototype. This is simple fingering kind of device which has camera which scans the text as the person moves his finger on one particular book. The text in that particular book, that particular line will be captured by will be scanned by camera, and it will be read out for him. This is in the prototype stage, and the final product will be standalone device in which the complete processor will be within itself. And as we know that the blind person cannot navigate his finger in a straight line, so we have added another feature, that is right angle guide, which is 90 degrees to the book and which guides him to go in one particular straight line. So even we have added the audio feedback to guide him. This is the starting of the sentence. This is the ending of the sentence. And we have showed this prototype to many end users like blind people, old age old age home people, and to government school students and teachers. And we have got very good feedback, and based on and people suggested very good improvements that needs to be incorporated in the product. So we are in the phase which we are including all these improvements into our product, into the prototype. We have divided company timeline into 5 phases. We are right now in the validate phase. In the validate phase, we are incorporating the improvements suggested by the end users. The next is improve efficiency phase, in which we will improve the algorithm fastness and all. And the next phase is scale phase, in which we'll contact many hospitals, industries, and become partners with them. And we'll fix the price of the product. And scale phase, and last is a sustain phase, in which we will keep on innovating based on the problem we are trying to solve right now. We are a team of 4 people. We four are engineers, and we have advisors as Dr. Mishkin and Dr. Dashanayak. These both are co-founders of Biosense. Thanks a lot.
What more does India need?
One feels so inadequate after listening to such brilliance. And Mr. Mishra, you're absolutely right. When a country has so much of intellect amongst the young, I think it's high time that it junked people like us of our age. And it is because you listen to people of our age. I don't understand why you're not walking away, is why this country is in the mess that it is. So thank you, all of you, from Sham. You guys are simply brilliant. Hats off to you. I don't know about the rest of you, but it gives me a lump in the throat just to say that this session and meeting you guys and the work that you do has made this Ficci Heal the biggest success in the 9 years that I have been attending it. Thank you very much. This is not the time at 6 o'clock when a cup of coffee is waiting for you outside for you to listen anymore. But it's just to say that Ficci Heal has come a long way in the last 9 years. Last night was the 7th Ficci Heal Excellence Awards. But Ficci Heal also this time also had disruptive innovations. We ourselves, the whole team, felt that a lot of the same faces, a lot of the same subjects were being repeated in all industry meetings, which was making it boring for some of us who attend all of them. What we wanted to do was to provide a platform for new thinkers in new subjects in a new India, and to invite a lot of youngsters from management institutions, from IHMR, from Symbiosis, from InLead. So many of you have come here. And I hope that when you go back, you would have learned something. From the morning yesterday when we had Dr. Jitendra Singh himself, a diabetologist, come and be the chief guest of this Ficci Heal, to the end when we've had our old friend, Mr. Mishra, concluding the things. I think you will all agree who attended the 2 days session that this team led by Dr. Jairam, Ashok and Vishal, and of course supported by Shobha and her team, too many of us in her team, to say that this has been a great success. Now it's easy to pat one's back, but the best thing that one can hope for is for you to write to us, send us an email, and let us know what you thought of the various sessions. Your feedback will be important for us to plan for next year's Ficci Heal. One thing we can promise, that this committee will continue to innovate, and those innovatives will not be incremental,
but disruptive. Ladies and gentlemen, Mr. Mishra, Vishal, Vijay, and the entire team on the dais, all of you, thank you very much for being with us, these speakers.